Welcome, everyone, to the Bob and Brad live event. Today, I am joined by our friend Rick Olderman, who is a physical therapist, and we are going to be talking about the secret to fixing your pain. So, we're going to be taking any of your questions and try to answer them to the best of our abilities remotely. But before we get going, Rick, do you want to tell them a little bit about yourself?
Sure, I'm an orthopedic physical therapist for almost 30 years now. I've written 9 books. My latest one is called Pain Patterns, and it's for people who have stubborn or chronic pain or recurring pain that they just can't seem to figure out. And this book I believe that this information would get to the bottom of it for you.
So, anyone tuning in, just feel free to leave your comments and we will get to them. We don't have any yet. We do have 43 viewers, though. So, feel free to ask your questions as vague or detailed as you want to get, and we'll try our best to get through them all. Rick, do you want to explain a little bit about your website and where people can find all your work at?
Sure. My website is rickolderman.com, and I've also created home programs to help people solve their pain. I have 5 of them, I think, and so they'll take people through uh, exercises to solve their pain. And the thing that's different about the way I look at things, and people will find this out, I think, in the course of this episode today, is that I'm more of a systems thinker in terms of how the body works as a system and putting things together like that rather than isolating components. So, and I think this is why people develop chronic pain is because they've been seen by a medical profession that likes to isolate things and try to identify a tissue that's damaged, but they're not really identifying why the tissues are damaged. And so that's, you know, a lot of the answers that we'll be talking about today will include this whole systems thinking approach, which is, I think, unique in medicine.
I just want to remind everyone watching that you can certainly rewind anything while we're live if you missed a part or we refer back to the video. It'll also stay on Facebook for a prolonged period of time or on our YouTube channel. It'll be there indefinitely. So if you kind of forgot what we told you, you can simply go back to the video and watch it. I'm still waiting for questions to start popping in, Rick. So do you want to talk about anything specifically first?
Well, I just had a patient yesterday I think was interesting. So she had chronic sciatic pain. She had it almost 30 years prior. She went to an osteopath. They did one session and it went away for 15 years. And then she got it again starting 3 or 4 years ago, and has been to multiple practitioners, and no one's been able to figure it out. And so I think we pretty much figured it out. And her pain was 90% reduced after just one of the exercises I asked her to do, which was really heartening. And so what it ended up doing, so the thing that I think everyone keeps missing with a lot of these chronic issues is that I insist on trying to figure out why it originally started in the first place. And so she had no idea, no previous injuries and so forth. So we eventually narrowed it down to what was likely the original injury, which was an ankle issue, and found that her calf and soleus range of motion was about 50% of her other leg. And so she was constantly unloading that side calf and soleus. Well, when you unload, if you have a problem, let's say in your right foot, well, this is the left foot. If you have a problem in the left foot, what happens is you start to unload that in many cases, and you shift over to the other leg to carry the load. Well, what happens is a response to that is that the muscles that attach from the rib cage down to the pelvis then hike this hip up. And so this is what the pattern that she had was that her right pelvis was elevated and her rib cage was depressed, creating a side bending problem. And you can imagine that in a case like this, then there is increased compression on the cervical spine on this side. And this is why she was having sciatic pain. So an easy way to feel this in yourself is if you just stand up and you put your hands on your hips and you just shift over to one leg, you'll feel that the opposite hip hikes up. And if you shift over to the other leg, you'll feel that hip hikes up. So in if you're one of these people who has an old injury that you've been shifting off of for many years, then likely your body has developed this side bending pattern, which is responsible for most unilateral back and sciatic pain. Anyway, it was really a lot of fun working with her. She was a chemistry professor at one of the local engineering universities here, and very type A, wanted to, does all the sports and does them intensely, so really, and this is where after you work with a lot of people for a period of time, the key for her is not to give her too many things. So she wanted to do, tell me what I need to do. Tell me, is that all? And I'm just like,
That's
we're
me.
gonna rein you in because you're working too hard at too many things, and you need to be more specific and work more gently with your body to tease all of this stuff out. So those were two new concepts for her.
So we do have some questions coming in. I'll answer Margaret quick. She just wants to know if I can see your comment. Yes, Margaret, I can see your comment. So if you want to ask something, go ahead.
That was an easy one, Margaret.
Yeah. Our first one comes from Annie. She has 2 comments. Lower back pain on walking in the morning. What do you recommend? I swim every other day. And then she followed up with tingling in right upper leg area after sitting for a while.
Yeah. So what was her name?
Annie.
Annie. So Annie, my question first of all would be: is your lower back pain is it central or is it on one side of your body? And I'm wondering that because you said you have tingling in your right upper leg. So I'm wondering if your low back pain is on your right side more than left or central. So that would be one of the things that I would ask. So if it's, I don't know if she'll get back to us in time, but basically what happens with walking, so this is a really good question because our walking pattern is central to how our whole body system works. And most people with a chronic problem are walking incorrectly. And I'll explain what that is in just a sec here. So what is likely happening is when most people are walking, what they're doing is they're sending their foot out in front of them with their body lagging behind them. So it just kind of looks like this, just like a normal walk. All right. Well, when that happens, the knee tends to lock straight, and that turns off the gluteal muscles in the back. The gluteal muscles have many, many functions. They're a really important muscle group. But the biggest function that they have is that they help control the pelvis and the low back area. And so if your gluteal muscles are turned off as you're coming into weight bearing, then there's nothing controlling the spine and the pelvis as you're walking. And so this is where, no one got out of my clinic without me teaching them how to walk correctly. And so the way that you should be walking is that your body should be moving forward with the advancing foot instead of the foot moving forward without your body. Now, initially, if you've been walking with your foot advancing without your body, this is going to feel really weird. And you're going to say, this can't be right. Well, it only feels like that because you have not developed the habit to walk correctly. You've developed the habit to walk incorrectly. So to walk correctly, you'll initially just want to take smaller steps and try and let your body move forward with the advancing foot. When that happens, the knee unlocks and the gluteal muscle turns on automatically, which is controlling the thigh bone rotation, pelvic orientation, and therefore lumbar spine orientation.
I would like to mention I can't read because she said waking, not walking. My bad.
Oh,
put an L in there.
Okay. All right. So waking. And it's right thigh pain with waking. So here's the common denominator with both of those complaints. Walking is an upright activity, and usually sleeping is you could think of it as an upright activity, but done horizontally. So likely she has probably an extension problem, which means that her back feels more pain when it's more arched. And a really easy, quick test would be, Anne, if you were lying down on the floor, would your back feel better if your knees were bent or if your legs were straight? And if 99% of people with chronic back pain feel that their back pain feels better when their knees are bent. If that's the case, what's happening to your spine when your knees are bending? Well, your spine is actually flattening and it's relieving your pain. So what's happening with your walking and lying down is that your back is becoming too arched when you're doing those things. Learning to walk with your body moving forward over the foot will help reduce some of that arch, because when the glutes turn on, they help posteriorly tilt the pelvis just a little bit, which takes that little excessive arch out of the back. So the other thing that is likely contributing to this is that many people with an extension problem also have tight thigh muscles in the front of their legs. And so what that does is the thigh muscles are attached to the front of the pelvis here. And when they're tight, they tend to pull the pelvis forward, and that then creates more of an arch in the back. So using a thigh stretch can be very effective for eliminating chronic back pain. And the woman I was talking about earlier, the exercise that reduced her sciatic pain by 90% was a thigh stretch. And so this is a very common but missed exercise because most people don't understand systematically how the thigh muscles are attached to the low back area and pain.
She did say knees up is better. So I'm
Yes. So you have an extension problem. That means that your back is too arched. And so if you start simply walking with your body coming forward with your foot and unlocking your knees, I can almost guarantee that within a day or two, your back is going to feel significantly better. And then also knowing that you have an extension problem and that you have thigh pain, I'm going to guess that you have tight thigh muscles. And I'm happy to demonstrate a thigh stretch here that might be helpful, Mike, or we can move on.
Yeah, you
Okay.
can show that quick,
All right.
and then we'll go on because there's a lot of questions coming in.
All right, so I'm just going to tilt this here. All right, so I'm going to do it on this bench here. This is very effective. And this is what I believe is the best thigh stretch, because if you do a standing thigh stretch, what's happening is that your back is just arching to accommodate the tight thigh. So you're not really solving a problem. You're just reinforcing the pattern that's causing your pain. The best thigh stretch that I find is that if you can lie down on a firm surface, hug your knees to your chest, make sure your back is happy, hold on to one knee with both hands, keep it here, and then lower this leg down with your knee bent at 90 degrees. This controls the pelvis and the spine so they're not damaged while stretching the thigh, and you will very acutely feel any thigh tightness in this kind of a stretch. You do that for 60 seconds. You bring that up, reset your back and pelvis just in case things shifted, and then you do the other side. And you do that twice for 60 seconds each leg. And when you get up from there, you should feel that your back pain is significantly feeling better because you no longer have the thigh muscles tugging forward on the pelvis.
Our next question is another back one. It's pretty specific, but I'll give it a try. This is from E.T. himself. And he has a picture of an alien. So anyway, lowest vertebrae locked in a forward position for 20 years and about 11 years a permanently damaged knee. These two wrecking my hips, much pain and inflammation is what they said.
Yeah. So again, so the way he is describing this is a component thinking approach. So I'm going to guess that ET has seen chiropractors or manual physical therapists or osteopaths who have, because no one ever comes to you with saying, oh, I've got a lower vertebrae that's forward tilted. You know, that only happens when you have someone who is very into manual therapy and trying to fix individual things, joints, vertebrae, and so forth. Let's back up. This has been happening for 20 years. So for some reason, that manual approach doesn't seem to be working. So let's back up and think of your body as a system. So ET, go back to the test I just described. Does your back feel better with your legs bent or straight when you're laying on a firm surface like a floor? And that will tell you the general shape of the spine problem that you need to solve, rather than an individual vertebrae, because there are so many forces and different things that are acting on each separate vertebrae. You can't possibly control one vertebrae and not another, and not have it carry over. You've got to think of the body as a system.
I have a question on sciatica. This is Margaret, the one who asked if we could hear her. So went to the doc, got meds, methylprednisone, hadn't taken them yet. However, the sciatic nerve, which goes down to my calf, is now starting to go into my feet. I'm concerned because I take other meds, and I did put a call to the pharmacy. Is there anything I can do to relieve the pain from a therapeutic goal through exercise?
Yeah. So what is it, Margaret? Yeah.
Margaret.
So what Margaret is experiencing is what we call peripheralization of symptoms. All right. So all that means is when sciatic pain is getting worse, it goes further and further down the leg. The converse is also true. When sciatic pain gets better, you'll feel it less and less down the leg, but it might feel more intense up the leg until you solve it completely. So this is also a common pattern that confuses people, is that they may have had sciatic pain in their foot, and we're treating them and they're just like, oh, I don't have any more pain in my foot, but gosh, my butt is killing me. Well, that's good news, because that means that we are centralizing the pain and bringing it back to the origin of what's happening. So this is the general pattern that you're going to want to look for, Margaret, is to feel that it's less in the calf now, but maybe you feel more intensely in your hamstring or your butt or something like that. That's a good sign that you're centralizing the pain. All right. So so far, Margaret, you were talking about medications, and I hate to sound like a broken record, but most sciatic pain, again, go back to that test I just described earlier. Does your sciatic pain feel better with your knees bent when you're lying on the floor, or does it feel better with your legs straight? Most people will say that their sciatic pain feels better when their knees are bent. When the most obvious reason that would be contributing to that then would be your tight thigh muscles. Again, and I just described the stretch to stretch the tight thigh muscles. I would be really curious, Margaret, if you found that let's say it was a right sciatic pain, if you found that your right thigh muscle was tighter than your left thigh muscle. If that's happening, then the right side of your pelvis is being pulled forward more than your left, which creates a torsion across the pelvis that can cause SI joint pain, sciatic pain, and other types of problems. But it's driven by the tight thigh muscle. And again, I mentioned this at the very beginning, this sciatic pain patient I saw. Ultimately, though, we have to understand why your thigh muscle is tighter on the right side. Are you compensating for some other problem lower down the chain that's causing you either to overload or unload the right leg? And I can show you a really simple test to determine that, if you're interested.
Yeah, why don't you go ahead and show it? I'm trying to look up a question someone had.
Okay, so let's say that you have someone like Margaret or ET or Anne at the beginning, and they've got pain, and it might be unilateral pain like sciatic pain or something, but they're not sure, oh gosh, is it coming from my right leg or is it coming from my left? This simple test will really help you figure that out quickly. So you just get a chair, and it needs to be a chair that you can stand up from with just one leg. And so put as much padding or books on it as you need to in order to do that. But it also needs to be challenging. So don't make it like a bar stool where, oh yeah, I can do that, no problem. It needs to be somewhat challenging so you can get feedback about your body. Now, I'm going to use this chair. However, I just ran a marathon this past weekend, and my thighs are really sore. So I don't even know if I can stand up on this chair. So anyway, what you're going to do is you're going to just sit on the chair, and you're going to lift one foot, and you're going to stand up. And it doesn't matter which leg you stand up with. And then you're going to sit down, and you're going to stand up with the other leg. All right. Which leg is stronger? So if the stronger leg is the side of your sciatic pain, let's say I have right sciatic pain and my right leg feels much stronger to me. Well, that means that because it doesn't make sense that you would have pain on the stronger side, right? So you must be compensating for something on your left side that you're avoiding. And therefore, you're likely overusing your right side, which is now breaking down and causing sciatic pain. Now, if you have right sciatic pain and you found out that your right leg is weaker, then it means that your problem is likely in your right leg, because that makes logical sense that a painful side would also be the weaker side. Does that make sense, Mike?
Yeah, sorry. I'm like, there's so many questions coming.
That's okay.
I'll let you talk and me navigate.
All of this stuff is in my book, Pain Patterns, and it takes you through it. And the second half of the book works as a workbook. So you can work through all of these kinds of tests to figure out where the problems are and what to fix in your body. Little plug.
Yeah. We've had a lot of questions on back pain. So a lot of these symptoms people are mentioning overlap with what Rick has already been talking about. So I'm going to kind of go down just so we get some other subject matter in here, because we're getting a lot of different things. So So someone, this is interesting. I have carpal tunnel from pregnancy. My whole arm is completely numb and a burning pain. Nighttime is the worst. I have tried KT tape, massage gun, and a brace. Massage gun and KT work. Sometimes the brace makes my hand hurt more. If the whole arm is numb, that's not carpal tunnel. You might be getting some nerve impingement coming from your neck, Brittany. Comes from Brittany. Especially, yeah, because whole arm, it doesn't. Carpal tunnel is just here in the wrist, so that wouldn't refer upward, where nerve pain can refer down. Do you have any tips you want to give?
Well, you're absolutely right, Mike. That was the first thing that jumped out at me too. So she may have carpal tunnel, but she may have all sorts of other nerve problems in her upper extremity as well. So, and it sounds like she does. And so my first question would be, what previous injuries have you had in your arm or shoulder? So a way to think about the upper body, think of what we've been talking about so far is the lower body system and how it influences back and sciatic pain. The upper body also has a system. And just like the pelvis, where the pelvis, you can see these big, broad, flat bones are the center of function for the lower body and low back system. We also have a broad, flat bone in the upper body system too, and it's called the scapula. And that is the center of function for the entire upper body and neck system. And so there are rules about how the shoulder blade should be resting and moving. And what I have found is that most therapists aren't aware of these rules, or they don't measure the shoulder blade in terms of these types of things. Whenever you go to a healthcare practitioner, when they hear neurological symptoms, they automatically think, oh, it's got to be coming from your neck. Well, that's only part of the answer, because we have to understand why it's coming from the neck. Usually why it's coming from the neck is because of the shoulder blade. The shoulder blade has significant muscular attachments into the vertebrae of the neck and the base of the skull. So shoulder blade dysfunction can cause neck issues, neck pain, headaches, and radicular symptoms down the arm. And so this sounds like what I can't remember. Is it Bridget?
Brittany, I believe.
Brittany. Okay, so this sounds like probably what Brittany is going through is that I'm going to guess that she has what I call the most common problem is a depressed shoulder blade where it's sitting too low, which then triggers the levator scapula to be in slight spasm, which then causes the compression on that side of the vertebrae, which then compresses the nerve roots coming down the arm. This is how the body works. And it may even be that she has a depressed rib cage on which the shoulder blade is resting, which is then affecting the neck. So another interesting question would be, does she also happen to have one-sided back or sciatic pain or history of problems in the same side of her body as her arm pain? This would likely then indicate that her rib cage is depressed, which is then dragging down the shoulder blade, which is then tractioning the cervical region. So all that being said, one of the simplest exercises you can do to see if this feels better is to get on your hands and knees on the floor, and you just rock back onto your heels while your arms are overhead like this. What this will do, Brittany, was it?
Yep.
I can't remember. All right, what this will do, Brittany, is it will help pull the shoulder blade up towards your head and reverse the scapular depression. It will stretch the muscles that are attaching to the bottom of the shoulder blade and the rib cage, and that may be too tight and pulling everything down. That simple exercise will help pull everything back up again and stretch those out and restore that. So I would be really curious if I was seeing you in the clinic, that would be one of the first exercises I would try with you to see if this alleviates the symptoms down your arm. If it does, then you know that you have a depressed shoulder blade, which may be caused by the rib cage.
She has commented, I had a brachial plexus injury from birth, mild scoliosis. So that makes sense.
Okay, so mild scoliosis, what scoliosis does is it creates, and I'm not sure that this is happening in her, but in moderate cases, it creates a rib hump in the rib cage that makes it difficult for the shoulder blade to move correctly over. And what I have found is that most people who have that rib hump They either pull their scapula too close to their spine to get on one side of that rib hump, or they let the scapula travel too far away from the spine to get on the other side of that rib hump. So this makes me wonder if this is what's happening to her. Regardless, if she does that little all fours rocking stretch that I just described, and it reduces her symptoms, then scapular depression is likely a component of her pain. And so we would have to fix the reason for the scapular depression. This stretch is fixing one of those reasons, which is tight scapular depressor muscles, and possibly, and especially if she has scoliosis, that means that she likely has a rib cage depression on that side too.
Well, I have a question from Wisconsin mom who was upset I skipped it earlier. So I apologize, Wisconsin mom. I'm Minnesota boy, I guess. Anyway, no back pain, but bilateral sciatica. Core exercise and motion helps, but doesn't cure. Have degenerative discs and spondylolisthesis. Can I avoid surgery? She commented later, just got orthotics that help as well when walking and with pelvic tilt, is what she wrote.
You have any comments on that one, Mike?
I'm gonna let you take it away because I have so many questions coming.
Yeah. Okay. All right. So when I hear bilateral sciatica symptoms, I automatically think a central disc issue. All right. And so, but that doesn't mean that all hope is lost. It could mean simply, like we described before, do your bilateral symptoms feel better with your knees bent lying on the floor, or do they feel better with your legs straight? Likely, your symptoms feel better with your knees bent. And so if that's the case, then that means something about your lower body system is contributing to the excessive extension and compression of the disc in the back. By the way, an extension problem, like I described from the very beginning of this episode, causes increased disc pressure in the spine. So what I would wonder is first do that test, Wisconsin mom, and then if it turns out that yes, my sciatic pain seems to feel better with my knees bent, then I would do the stretch that I described at the very beginning of the podcast episode to see if it is tight thighs that are contributing to the excessive anterior tilting of your pelvis. Now, one of the good news is of what you gave us was that orthotics are helping you. So that means that there must be something in your lower body chain that is contributing to the excessive compression of the disc in your spine. And if you remember also when I went over how to walk correctly, learning to walk with your body advancing with the foot rather than the foot advancing without the body is going to be key likely to your issue, since orthotics are also helping. So you need to learn to walk with softer knees and have the body advance with the advancing foot. And that will help control the pelvis, which will then help reduce pressure in the disc area.
We had a question from, she did say it felt a little better flexion, but not a lot of difference.
Yeah, well, especially with sciatic pain and depending on how far it's going down the body, sometimes it takes a minute or two with you being in that position and then getting back up and testing it to see whether it actually feels better or not. Because neurological symptoms don't just often go away like this. Sometimes it takes a minute or two of a position to test that position to see how effective it is for you.
I just want to say hi to Beatrice because she watches every week and comments. Hi, Beatrice. So Romeo asks, had a tibial fracture in February. What I must prioritize? Romeo, a lot of it depends upon where you are, because a lot of times people have weight bearing restrictions for a while. I'm guessing by now you're allowed full weight bearing. But any type of standing, exercising, shifting weight onto that side, standing on one leg is good to work your balance. Oftentimes when people injure a leg, your balance gets kind of compromised. Stuff like that can generally help. I don't know if you have any other suggestions for Romeo.
Well, this is curious to me because that is a specific medical issue that I'm hoping that he has a medical team that's guiding him through on this.
Yeah, that's what
So
I'm hoping you saw a PT.
Yeah, I'm hoping you have a PT, and they would tell you all of what Mike just said. But it also makes me wonder if you have gone to PT and you're left with problems after. So, there are different types of tibial fractures that you can have. So that informs how complicated this can become. So we're not sure of the type of tibial fracture that you have. But one of the common things that I've found with people who have these types or lower body injuries is that the calf and soleus muscle develops tightness. When the calf and soleus muscles, so the calf muscle is, almost everyone knows what a calf muscle is. It goes from the heel to above the knee, but the soleus runs deep to it, and it goes from the heel to about here on the lower leg bone in the back. Both of those insert into the Achilles tendon. So the soleus especially is important for allowing the knee to bend as you're walking. Or if you live in a hilly area, like Mike was saying, we don't, where you are has a lot to do with this. If you live in a hilly area and you're trying to walk uphill and you have restricted calf and soleus range of motion, then that will then create problems either up that chain or into the other leg, because you're unloading that ankle complex because it doesn't bend well. So one of the things that I would make sure that you have
I just want
is
to.
adequate length of the calf and soleus muscles.
He said tibial plateau.
Tibial plateau. Oh, okay, great. All right.
So
yeah, even with a tibial plateau fracture, you want to make sure, because you've had a period of immobilization, and what happens is that calf and soleus muscle does get tight. And so again, if any of you have ever, like I have several times, mistakenly run into a table or a doorway, it always surprises me how much force my body has generated in just a half a step when I run into something that I didn't expect being there. So our bodies are creating tremendous forces moving forward just to walk forward. And so if there's a restriction at something fundamental like the ankle that is preventing that movement forward, that force has to go someplace else. And it will either go up to the knee, hip, pelvis, or back, or over to the opposite leg. Because most people have, like in this guy's case, Romeo's case, that he's developed a tibial plateau fracture, he spent a period of time likely non-weight bearing on that side. And so his brain has learned that, oh, when I run into a problem, I'm just going to overload the other leg instead. So what Romeo needs to do is first test to see whether his ankle range of motion is good and has adequate calf and soleus length to allow ankle range of motion to occur. And if that's not good, then you have to make that good, because that is then going to allow the whole lower body system to weight bear correctly. Now, one last thing I want to comment about this, especially with any kind of knee injury, especially a tibial plateau injury, is that in the back of the knee, we have a little muscle that runs from the inside of the knee to the outside of the upper thigh bone, and it's called the popliteus muscle. What happens with a lot of these types of tibial plateau, knee surgeries, and so forth is that the popliteus muscle goes into spasm. The popliteus muscle protects the knee from going into hyperextension, but it also controls, because it runs from the inside to the outside of the knee, it also controls rotation of the knee joint. And so if the popliteus is in spasm, then it's locking the knee into a rotated position, and it's forcing you to weight bear on portions of the knee that it shouldn't be weight bearing on. I have had tremendous success having people get a massage to their popliteus and gain instant 15 to 20 degrees of range of motion and knee range of motion, first of all. But then second of all, they feel a freedom in their knee that they haven't felt for years or months. So if you are seeing a physical therapist or a massage therapist, Romeo, ask them to please take 10 minutes and massage your popliteus muscle. Likely it's such an unfamiliar muscle, at least in physical therapy, they may have to look it up, but it is critical to proper knee function. And I can almost guarantee that you will feel a significant relief in pain after massaging that muscle.
Next question comes from Kimberly. She's got a bit going on here. I broke my hip last year, lost all my muscle, had a total knee replacement in December. I still can't put weight between my knee and foot while bent. If I did, I'd be on the floor. Any suggestions? I'm assuming, Kimberly, it's the same side you broke your hip and had the knee replacement. I guess it'd be the first clarification. And then I'm curious how much knee motion you have, because if it's buckling like that, I'm assuming if she lost muscle, she just has a lot of weakness.
I'm assuming that too. And then this goes back to what we just talked about, Mike, I think, with the ankle range of motion. Again, if the ankle can't bend well, and again, with a knee replacement and with a hip surgery, you're unloading that side of your body. So it's very frequent that the ankle joint becomes very tight, the calf and soleus muscles. And so if the ankle joint can't bear weight well because it's too tight, it's not allowing the knee to bend and so forth, then that is throwing the force of your forward advancement back to your knee and your hip, which just got operated on. So that is one of the things, and this is I don't quite understand when she's talking about the space between her foot and her knee collapses.
Yeah.
Is that what she said?
Yeah, it sounds to me like her knee's just buckling. That's what I'm getting out of it.
One of the reasons that the knee buckles is because the ankle isn't absorbing what it should be. So, and which then puts abnormal force, causes the rest of the leg muscles to do more work than they should. And so that would then be interpreted as leg weakness in that side, when actually it's a lack of range of motion in the ankle. Now, the other thing I would recommend is just what I just talked about. I love how these are segueing together.
That's why I went to that question.
is the popliteus muscle, right, in the back of that knee. I'm going to bet that no one has ever massaged her popliteus muscle in the back of her knee during her rehab. And then that is also causing the knee to be slightly rotated, and which makes it painful to weight bear on. So please explore the popliteus massage. And in my hip pain home program or my knee pain home program, I show how to do that correctly, the popliteus massage. But I also show you a way to do it yourself. But anyway, I just find that is, ankle range of motion and unlocking the popliteus so the knee isn't weight bearing on a rotated knee joint makes a huge difference for a lot of these people. I had a woman come into my clinic with an acute tibial plateau fracture, Mike, and it had happened within the last 3 days. She came in, her popliteus was in spasm. She was in a lot of pain. I massaged it out. She walked out without a limp and no pain. That's how important that popliteus muscle is to knee function and pain. So I can't emphasize that enough. It's an easy, fast fix.
She did clarify it is the same leg, the hip and the knee, and she has about 105 degrees of flexion, which is, it's functional.
Not great, but functional, barely. I mean, don't you need 110 to sit in a chair?
It depends on how high your chair is.
Yeah. So well, even a car,
Yeah.
So this is, I had another guy who had massive reconstruction of his knee. He was on one of those scooters, that you see, those electric scooters. He decided to try one. Within 15 seconds, the scooter was going way too fast. He fell off and wrapped his knee around a tree.
Oh.
So he had major reconstructive surgery of his knee. And I saw him after his surgery. And he was in so much pain. The only thing I did was massage his popliteus muscle in the back of his knee. He instantly gained 20 degrees of knee extension and 10 degrees of knee flexion by having the popliteus massaged. I hate to sound like a broken record, but when you understand how the body works as a system, then when you push the right button, the whole system responds. And the popliteus for the knee joint is one of those right buttons.
We have a lot of questions still coming in, but Soson says lots of pain in my upper legs under my buttock. Pain is bad when I sleep. So I'm guessing they have a flexor or extensor problem.
Well, it sounds like piriformis syndrome, right? What we typically call a piriformis syndrome. All right. So why does piriformis syndrome occur? Well, the piriformis runs from the sacrum here to the hip bone. All right. And it's a little teeny tiny pinky muscle. And it reinforces the big massive hand muscle, which is the gluteus muscle. And so when the gluteal muscle doesn't work well, it forces the little pinky muscle to do more work. And that's why often the piriformis goes into spasm, is because one of the reasons is that the gluteal muscle isn't working well. So again, this goes back to walking correctly, because when you walk correctly and have your body advance with the advancing foot and your knee is unlocked, it automatically turns on the gluteal muscle. So it is doing the primary function of the pelvis and controlling the thigh bone and all this kind of stuff. And then it will automatically then start unloading the piriformis muscle. So that is one thing I would really experiment with, is learning how to walk. And it's so easy, because all you have to do is just put your hands on your butt cheeks and walk around. And if you don't feel that your butt cheeks are turning on when you're walking around, it means that your butt isn't working. So the next thing that you would then do is walk around on your tippy toes, and almost guaranteed you're going to feel that your butt muscles are starting to turn on now. And then you start lowering the heels back down after 5 or 10 steps, and you'll feel that your butt continues to turn on. Well, what is it about tiptoe walking versus your normal walking that's getting the butt to turn on? It's the fact that when you're tiptoe walking, it is impossible to lock your knees. And it is impossible for you to have your foot advance without you. Your body has to be over the foot at foot strike, and your knee has to be unlocked. Those are the two things that need to happen to turn the butt muscle on. So what I would tell this person is, if you're feeling that pain in your butt, walk around on your tippy toes. Does that pain go away? If it does, that means that you're activating your glute and it's unloading that piriformis, which is taking away your pain for you.
There are a lot of questions. I'm going to try to get some other body parts here. I apologize, everyone. We're going to get to as many as we can, but we got about 18 minutes left here. So we had a question. Where did it go? Oh my gosh. There it is. I had rotor surgery, I'm guessing rotator cuff. October 4th, have not got back full rotation. I'm a swimmer, still have pain in last half of rotation. Suggestions on any stretches? This is from Vicky.
Good luck, Vicky.
Rick's had surgery on his shoulder.
I had surgery in October, and I actually have more pain now than before my surgery. So shoulders are tricky. But generally, what I've found, Vicky, in general, is, and my range of motion is excellent, though. So it's just pain. And my strength is excellent too. So what I have found with shoulder work is that it's much easier to move the body away from your hand than it is to move your hand away from the body. What do I mean by that? Well, I described earlier this child's pose kind of stretch where you're on your elbows or hands and knees on the floor, and you sit back on your heels like this. This is anchoring the hands as you rock back, and it then increases the shoulder range of motion into flexion, right? So this is what I mean by having your body move away from the hand rather than your hand move away from the body. And so the same thing works with external rotation too. What I did here at home, you'll see I have a little exercise bike here in my studio. I simply put my hand on the bike, and then I rotated my body away from the hand to work on my external rotation range of motion. And I found that was much easier than me trying to, push it out to the outside and all that, because pain is inhibiting muscle function. Well, in this way, you don't have to worry about muscle function to get to the range of motion you're looking for. You're just using your body to get there. And this is what really rapidly increased my external rotation range of motion. And frankly, my flexion and all of my other ranges of motion too for my shoulder was using the floor or items around the house in creative ways to move my body away from the hand. And what I would say is, rather than devoting 10 minutes to one exercise of external rotation, you can certainly do that. But if you do that, follow it up with several 1 or 2 minute sessions throughout the day. Whenever you pass the refrigerator, just turn and just let it stretch for 30 seconds or a minute here. Wherever you can, start peppering your day with these exercises so that it compounds itself throughout the day, and you get whatever benefit you've gained in that longer session will remain throughout the rest of the day.
We often tell people in the clinic when you're through the doorway, do it because
Yes.
the doorway is a good anchor as well. So,
Yeah. I like the refrigerator.
well,
I
there's
spend time
food and
there.
drinks in there.
Yes.
Here's a little different question from Susan. I have problems with idiopathic neuropathy in my feet. Any suggestions for improvement? I mean, from a PT perspective, we can tell you things to work on. Obviously, there's medications and nutrition things that can affect that as well. But from PT, it's you can't really necessarily get it to go away, but you just practice working on being on your feet more, making sure you're secure, working on your balance. That can just be standing on one leg while holding onto a countertop, getting used to, what sensation you have in your feet. And a lot of people, their footwear can dictate it too. Some people like more padding and prefer to be in shoes, and some people like less padding and they just want to be in slippers or barefoot. So the surface you're on can kind of dictate that as well. I don't know if you have anything to add.
Yeah, I think, just always, in physical therapy, what we care about is function.
Yeah.
So if you have, this neuropathy, just try what if you have excessive hammers hammering on that neuropathy, it will make it more painful, right? And so if we can remove some of those hammers from hammering on that, it might improve your pain and improve your function. So one of those hammers is tight calf and soleus muscles, which we talked about earlier today. If they have become too tight, then the force of your body moving forward over a tight calf and soleus muscle and ankle that isn't bending properly, one of the ways that force gets distributed is that as the body is trying to move over the foot, and because the ankle isn't bending, then the foot becomes excessively pronated, or there's too many forces that are pushing down through the foot. Well, there are 26 joints in the foot, so you have 26 joints that will absorb that force rather than it going back up the chain. So making sure that the knee and ankle can bend properly will help relieve a lot of the force that's acting through the foot bones and joints and ligaments uh, in all cases, but especially for idiopathic neuropathy, it may be one of the things that really reduces any pain that you're experiencing with this, and it will improve the function of the whole lower body system too. So the other thing I was wondering about, Mike, is those towel scrunching exercises with the toes, picking up marbles,
Oh,
just to
sure.
make sure that the muscles in your feet and toes are functioning well by gripping things and picking them up and so forth. So that's the other thing. And then lastly, if she has pain with walking, and she does have tight calf and soleus muscles, then it could be because of the excessive body force acting through the foot because the foot and ankle isn't bending. So there's orthotics can help with that, but I find that orthotics aren't specific enough to the foot function to correct all that needs to be corrected in these kinds of cases. I've developed a taping technique. It's in my foot pain program, but it's one piece of tape, but it holds up that arch very specifically and aggressively so that it doesn't collapse. So the foot doesn't get to go through all of the collapse that I just described. Instead, it pushes it back up to the knee and hip. And that seems to resolve a lot of people's pain who have, foot pain, plantar fasciitis pain, heel spur pain, things like that. If we can remove that force from acting through all of those joints in the foot, that can often relieve a lot of pain associated with these types of conditions.
I just want to address this question from Cindy real quick because we kind of answered it earlier. But back of knee pain into calf sometimes feels like lower hamstring pain. No Baker's sister clot. What could it be? Been different therapists. No one knows. So if you rewind the video, Cindy, we talked about a tight popliteus, which is a muscle behind your knee, and Rick talked about massaging it. Otherwise, you can look up popliteus, Popliteus. So you spell it?
Yep.
On the internet and look up how to massage it, or Rick has it in his home programs, or maybe your book. I don't know if it's in your book.
I don't know if it's in my book either. I can't remember.
It's in his own program anyway.
I think it is.
So yeah, if you know how to rewind the video watching live, Cindy, and just see where we're kind of talking about knees. We did kind of address something like that earlier. So Romeo's asking, that's the guy with the tibial plateau fracture, and you talked about glute activation. He just talked about, I'm guessing he means EMNS, electrical nerve muscle stimulation. For glute atrophy, do you want to talk about your glute pump exercise?
Yeah, I'll tell you, Romeo, nothing beats your brain. And ultimately, all the e-stim stuff does, it may help turn and stimulate muscle contraction. But what the problem is that your brain is not creating the muscle contraction. And ultimately, you can do all the e-stim in the world, and once you get off that machine and you go for a walk, your brain hasn't learned anything. So we have to teach your body how to use itself correctly. One of the ways, the most basic functional reason for the gluteal muscle contraction is walking correctly. So if you can walk correctly, that will turn on your glutes. And if you walk 10,000 steps a day, then you'll have 10,000 repetitions of butt strengthening exercises that is connecting your brain to that glute. However, I also have a butt pump exercise that I have people do where they get on their elbows and knees on the floor, and then you just lift up one leg and you just do a tiny little pump here. The focus is not to get the leg as high as you possibly can. The focus is to feel the butt contract to lift and lower the leg. You do not want to lower the leg to the point where the butt turns off. So oftentimes the range will be something like this, a tiny little pulse like this that will turn on the butt. Now, the gluteal muscle is an external rotator of the lower leg bone. So what a lot of people need to do is they need to rotate the knee slightly to the outside to activate that butt and bias it to turn on. And so you'll start the butt pump like this, do your 20 to 30 pulses like this. Once this gets really easy for you, then you can start bringing the knee back into alignment straight up and down again if you want to. You don't have to. But anyway, this is the best exercise I have found to activate the butt and actually get the brain connected to it. And then you reinforce this by immediately following that up with the glute walking exercises and tips and tricks that we talked about today to get that butt to really work while you're using your body. So this is what I think a lot of so many people come and say, which exercises do I need to solve this? You can do all the exercises in the world and they will be helpful, but if you're not using your body correctly, then those exercises will not solve the problem that you're trying to solve. Ultimately, you'll just have to continue doing these exercises for the rest of your life. Well, no one wants to do that. So just learn to use your body correctly. Your body is built to be used as a system of interacting parts. We're not trained in medicine to look at the body like this, but in my 30 years of being an orthopedic physical therapist, this is what I found is missing in these chronic pain, difficult cases.
Well, it's an interesting question, but I think it's, can TMJ cause low mood and depression if no pain and jaw only clicking sound? Well, I mean, if it's putting you in a bad mood, I guess. I don't know correlation between the two, but do you want to talk about TMJ syndrome a little bit?
Sure. Well, to answer that question, I think any chronic pain will cause low
They
mood
said
and
they
depression,
said they
right?
don't have pain, but it's a clicking sound.
Well, even if you think that something is wrong with you, and no matter what it is,
Yeah.
clicking, movement, whatever, if you think there's something wrong with you, then it's going to affect your mental state because you believe that you're broken in some way. And clicking is normal. Lots of people have clicking. This gets into hypermobility and hypomobility as well as TMJ issues, but not everyone has the same ligaments that are the same lengths. You have people who are hypermobile who have hyperextensive elbows. So I would ask this TMJ person, hey, do your elbows bend excessively, backwards? Do your knees bend backwards excessively? Do you have hypermobile fingers? If you do, then the clicking in your jaw is likely related to ligament laxity, which you're born with and you can't change, rather than some dysfunction in your jaw. So if that's the case for you, I wouldn't perseverate on the clicking because it's just a natural function of loose ligaments. So, I do some work with TMJ using hand somatics, which I find is very effective because it helps teach neurological control of the jaw muscles. And, but yeah, I'm assuming this person likely has gone to a TMJ specialist already if the clicking is bothering them that much. And if you haven't, then you can try going to a neurological specialist to see if they, or I'm sorry, a TMJ specialist to see if they can help you with that. But one of the first things, I don't know about you, Mike, but one of the first things they taught us in PT school is never try to treat a sound, because
Yeah.
all of us make sounds. And so the TMJ clicking is not indicative of anything necessarily wrong with your jaw. It's just a sound that your body makes, just like my hips make a lot of sounds, my back makes a lot of sound, my elbow makes a lot of sounds. Everyone's bodies make sounds.
Yeah, I have TMJ syndrome, and it doesn't hurt me either, but it does click sometimes. I can open my mouth so far, and then I feel it pop,
Yeah.
but it doesn't really bother me, and it doesn't put me in a different mood.
Yeah.
The first time it happened, I was very surprised because I was 18 and my jaw was locked open, and I had to
Ooh.
like get it to close. But after that, it's been fine.
Yeah.
But yeah,
And now look at you.
yeah,
You're
I'm just a
perfect.
big mouth. Anyway, yeah, that's it. There's a lot more questions here, but we can just hit this one real quick. We only got about 4 minutes left. So my pain doctor told me my multifidus muscle in the lower back are weak and need strengthening. What type of exercise would help with this? Thanks. And this comes from Lauren. Well, it's just spelled different. I think it's just Lauren.
Do you want to take this one, Mike, or no? I feel like I'm a broken record.
Well, you keep going. I'll see if there's another question we can hit
Okay,
before we're
so
done.
Lauren, all right. So if you look at any back model, you'll see the multifidus is a teeny, teeny, tiny little muscle that runs between the vertebrae. I don't know of anyone who can specifically identify that one teeny, teeny, tiny muscle in one segment of your back is not functioning. And even if it is, I don't know anyone who can target one teeny, teeny, tiny muscle that runs between two vertebrae. This is a function, and this goes back to the very statement I made at the very beginning of this podcast, is this is a component thinking diagnosis. And so what your practitioner has done is focused on a very small, specific problem that they have identified without understanding how the entire system affects that one problem, if it is even a problem. And this is one of the things that I found early in my career as a physical therapist, is that I would see patients with chronic pain, and their other, practitioners, whoever they were, would say, would blame it on something that they couldn't possibly fix, like a weak multifidus muscle, or, oh, your core strength just isn't strong enough, or, whatever other thing is going on. Oh, well, your pain is due to scoliosis. So the people walk away with a sense of, oh, well, this is something I can't seem to fix, because no matter what exercises I do to strengthen my core, I still have my back pain. Well, doesn't that mean then that your back pain might be due to something other than your core? The same with this multifidus muscle. I'm sure that this practitioner, if they told you that your multifidus is the cause of your back pain, I'm sure they must have treated it in some way, and your back pain still isn't gone. And so what that happens then is they say, oh, you just haven't been working hard enough, or you haven't been specific enough with your training, and things like that, and puts the blame on you. And as a therapist, this is how I saw this happening. I'm just realizing, look, these patients don't want to be in pain. They want to fix their issue, and they're trying hard. Maybe it's me that's the problem, and not the multifidus or the core or the scoliosis. And that's why I developed this whole systems thinking approach to understand what makes me think that multifidus is weak. And then I realized, oh, it's because it's being stressed or shut down by other areas of the body that aren't working properly, that I wasn't taught to understand and link to that area of the body. So I don't say this to criticize your practitioner or you. I say it because I want to open your eyes to other larger things that are likely going on causing your pain. That, especially if you've been working really hard trying to fix it, it's not because you're broken. It's not because your back is broken. It's because something else is going on that no one's identified yet. Usually those reasons are found in how the body is put together as a system that we in medicine are not trained to understand.
Do you want to take one more question? It is 11
Sure.
o'clock. We'll do one more because he's asked a few times. So, Mon, I experience neck pain even during normal daily activities, and the pain radiates to my head and arms, also shoulder. He kind of clarified later the pain is only on the right side and radiates from my neck to my head, right upward. Well, it sounds to me like your scapula is heavily involved, or you have some type of nerve issue going on. Do you
Yeah.
want to talk about the scapula quick?
Well, we talked about this in another question. If they, look back in the thing in the
Video.
episode, the scapula is the center of function for the upper body system. It can cause radicular symptoms that then go down the arm. Most practitioners, when they hear something radicular, they think, oh, it's got to be the spine. That's half of the answer. The other half is, why is the spine causing radicular symptoms? And that half usually has to do with scapular function because of the significant muscular attachments to the neck and the base of the skull that for some reason it's beyond me still. Most practitioners are unaware of or completely ignore when they think about these types of problems. They just keep looking at the neck and not the scapula that's feeding the neck. And so I'm going to guess what we talked about earlier was a depressed scapula. That is the most common problem that occurs with this, with the scapula that then can cause radicular or pain in the neck or headaches or any number of things. And then we also talked about a stretch that you can try to see if this helps you, where you're on your elbows and knees and you rock back onto your heels and stretch your arms up. And what that's doing is it's stretching the scapular depressors, allowing the scapula to rest where they should be after you're done with that stretch. And you should notice an almost immediate improvement in range of motion or reduction in pain if your pain is associated with scapular dysfunction, which in 99% of the cases I've seen with chronic neck radicular issues, it's the scapula.
I'm just going to tell this person that asked this question who to look up. Amit says, please suggest remedies for 5-year-old costochondritis pain. Look up a physiotherapist named Steve August. He's put his life work into that, and he has a thing called a back pod that really helps too. But just look up Steve August. You'll find a lot of information on him. He's from New Zealand. So, okay, well, that is it for today's live. If you would like to find out more about Rick Olderman, you can go to rickolderman.com, Olderman. All your programs and books can be found there, correct?
Yep.
And then if people want to work with you one-on-one or in a group session too, they can, correct?
Yeah, so people can work with me in a group session if they've already purchased one of my home programs, because then we're all on the same page when we begin. But that's not open to people who haven't purchased my home programs, because then I'd have to go back and start over again with everyone with every new question.
So,
and then they can also have an individual session with me if they like.
So Rick and I will be back next month doing a live here on the main channel because Brad has got a lot of vacation this summer, and I can't remember the other date exactly. Otherwise, you can find us on the Bob and Brad podcast channel. We answer questions once a month, just like this, and you can find all the stuff at rickolderman.com. And thank you for joining me today, Rick.
Thank you, Mike. I had fun.